Have you noticed your erections aren't quite as firm as they used to be? You might point the finger at testosterone or blood flow, and those do play a role, but there's a key component most men overlook: the pelvic floor. Those unseen muscles are the ones that actually trap blood inside the penis and help you stay fully hard. And like any muscle in the body, if they stop being trained, they gradually weaken. The great news is they respond incredibly well to exercise, even later in life. I'm Dr. Hana Kim, and in this routine, I'll show you 5 strong Kegel-focused movements you can perform at home without any equipment at all. They boost rigidity, control, and even support bladder function. Stick with me through the entire routine, because the last exercise is the one most guys skip, and it truly changes the game. Before we begin, get into a comfortable position and allow yourself a few minutes to concentrate. Consistency beats intensity every time. Doing 5 to 10 minutes daily will deliver better progress than one long, awkward session here and there. Start by lying on your back, knees bent around 45 degrees, feet planted hip-width apart. Keep your arms relaxed at your sides, palms down, so your body feels stable and calm. Take a few deep breaths, in through your nose and out through your mouth, just letting your body settle. Bring focus to your lower stomach and lower back. Lightly engage your core by drawing your belly button inward toward your spine and press the small of your back into the floor as though you're smoothing out any space underneath it. Gently tilt your pelvis upward until you feel a subtle activation through your lower abdominals and pelvic muscles. Don't push too hard. It should feel controlled and noticeable but not forced. That's your baseline position. This foundational exercise ties your deep core muscles to your pelvic floor so they activate together. Hold that tilt and contraction for 3 to 5 seconds while breathing smoothly through your nose. Then slowly release. Why it works. You're training co-contraction, meaning your pelvic floor and lower abs fire at the same time, which strengthens the muscles responsible for trapping blood inside the penis during an erection. Think of it as reinforcing a more reliable inner support system. How to progress. Begin with 10 to 15 quality repetitions. Form matters more than speed or numbers. As strength builds, increase to 20 or even 25 reps. Concentrate on smooth motion and full breaths. Over time, you'll feel stronger control and a more noticeable ability to maintain firmness when it counts. Next, lie face down on your mat with your legs stretched out and your forearms placed beneath your shoulders. Lift your chest slightly, more like a gentle cobra than a full back bend, keeping your neck in a neutral line. Pull your navel toward your spine again and gently engage the pelvic floor as if stopping a stream of urine. This movement pairs a front body stretch with pelvic floor activation. It loosens tight hip flexors while requiring your deep stabilizers, including the transverse abdominis and pelvic floor, to activate together. That boosts flexibility, endurance, and neural coordination. Crucial for intimate performance, this hold builds endurance. Maintain the position for 20 to 30 seconds while breathing deeply. Perform 3 to 4 sets, pausing 10 to 15 seconds between each. As you gain strength, lengthen the hold to 45 or even 60 seconds. Avoid breath holding. Consistent oxygen keeps the muscles working properly. You'll soon notice improved posture, reduced tension in the lower back, and a sharper awareness of your pelvic floor. Shift onto hands and knees in a tabletop stance. Wrists beneath shoulders, knees lined up under hips. Keep the spine neutral. Slowly exhale while drawing your navel inward toward your spine and lifting the pelvic floor at the same time. Picture lightly stopping urine or lifting those inner muscles upward. Shoulders relaxed, breathing smooth. Hold the contraction for 3 to 5 seconds, then release. This teaches your deep core to fire with the pelvic floor while coordinating contraction with breath. Especially helpful for stamina and control during intimate situations. Begin with 10 to 15 intentional slow repetitions. As control improves, extend each hold to 5 to 10 seconds and make tiny weight shifts forward or backward to engage different fibers. Lie on your back again, knees bent about 90 degrees, feet hip-width apart and positioned a foot from your glutes. Arms down at your sides, palms pressing lightly into the ground. Maintain a neutral spine. Drive through your heels to lift your hips until you form a straight line from knees to shoulders. That's the bridge. While holding the bridge, gently push the knees outward as though spreading the floor apart, then return to neutral. This action engages the pelvic floor along with your glutes and hip abductors. A potent trio. The glutes work as powerful pumps enhancing pelvic circulation, while the abductors stabilize everything. Together, they support steady blood flow and durability during activity. Complete 8 to 12 controlled repetitions, pausing 2 to 3 seconds on each outward push. Keep your core tight to avoid arching the back. Over the coming weeks, increase to 15 to 20 reps and add a resistance band above the knees for a more intense challenge. Men who stick to this consistently report stronger erections, improved pelvic stability, and less fatigue in the lower back. Return once more to all fours, but this time widen the knees comfortably with feet turned outward to open the inner thighs. Lower onto your forearms to keep the top half relaxed. Inhale steadily. Once you feel grounded, gently rock the hips forward and backward in a slow, controlled motion, like a subtle wave passing through the pelvis. This movement eases tight inner thigh muscles and deep pelvic floor tension, while training fluid coordination and enhancing circulation. That rocking motion also boosts lymphatic flow and helps fluids move freely in the area so blood supply stays strong. Reliable and ready. Perform for 30 to 40 seconds. Rest 20 to 30 seconds and repeat 3 rounds. If mobility is limited, reduce the width or place a pillow under your torso for comfort. After a couple of weeks, most men notice the stretch becomes smoother and incredibly satisfying. Many describe it as unlocking the region and increasing sensitivity and staying power. Combine all 5 movements into one brief daily routine. Pelvic tilt, 10 to 15 repetitions holding each 3 to 5 seconds. Prone lift, 3 to 4 rounds of 20 to 30 second holds. Tabletop draw-in, 10 to 15 reps with 3 to 5 second squeezes. Bridge with abduction, 8 to 12 reps, pausing the outward push for 2 to 3 seconds. Rocking frog, 3 sets of 30 to 40 seconds. Total time, roughly 5 to 10 minutes. Perform this every day, preferably at a consistent time. Many men prefer morning or before bed. Track your improvements. Write down changes in firmness, control, and confidence. Steady daily effort outweighs one occasional, overly intense session. These drills build strength, yes, but more importantly, they retrain coordination. The pelvic floor has to contract with the right timing to trap blood inside the penis and keep rigidity. They also boost circulation, free the hips, encourage lymph movement, and reduce long-held tension that restricts blood flow. Put together, they heighten sensitivity, erectile function, and bladder support. Stay focused on proper technique rather than rushing. Clean reps count. Keep breathing. Don't clench your jaw or hold air. Trim fingernails. Avoid anything that produces sharp pain. And if you have pelvic pain, surgical history, uncontrolled blood pressure, or a recent prostate procedure, check with a physician before starting. Any persistent discomfort or sudden new symptoms should be evaluated by a professional. Have realistic expectations but stay encouraged. Many men feel slight improvements in warmth, control, and morning firmness within weeks. More significant, durable results usually arrive after 6 to 12 weeks of consistency. The earlier and more steadily you commit, the greater your reward. Hydration is key because blood volume influences circulation. Keep digestion regular since constipation can increase pelvic tension. Light cardio plus mobility work can further enhance blood flow. Breathe calmly and manage stress because chronic tension tightens the pelvic floor. Once you're comfortable, mix in quick pulse Kegel squeezes to train fast twitch responses needed during intimacy. This isn't some flashy trick. It's legitimate conditioning. 5 to 10 focused minutes a day, performed correctly and repeatedly, can genuinely upgrade performance. Age doesn't disqualify you. These muscles adapt impressively well throughout life. Many men reclaim strength and firmness they assumed were gone forever. I'm Dr. Hana Kim. Stick with this routine for a few weeks and jot down what changes. With consistency, you might be amazed at how much more powerful, firm, and confident you become. Share this with a buddy who could use it, and subscribe for more practical, evidence-driven guidance for men. You've got this. A few intentional minutes a day can transform your